Welcome back. All right, y'all, today I've got a good one for you. What goes inside your nose after a rhinoplasty? If you've ever wondered about the recovery process and just what to expect, especially when it comes to what's placed inside of your nose, this video is for you. You might not realize this, but after a rhinoplasty, managing the inside of your nose is important for a very smooth recovery. Now, traditionally, many surgeons use nasal packing, which are just materials inserted into the nose to support healing. These packs, let's call them, help to reduce bleeding and oozing, they help to prevent internal scarring, and they keep the nasal passages open as they heal. Common types of packing that have been used for decades, years, centuries are Doyle splints and Maricel. Doyle splints are made of soft medical-grade silicone and are designed to support the nasal structure. Maricel, on the other hand, is a type of nasal packing that absorbs fluid and helps to control bleeding. While these traditional methods are very, very effective, they can be uncomfortable, especially during the removal process about a week after surgery. So here's where my approach differs. There's nothing wrong with what everyone else uses, but this has worked well for my patients and myself. So instead of using traditional packing, I use an emulsifying gel that minimizes bleeding and edema, which is swelling and inflammation, and it also prevents adhesions and scarring between the septum and the nasal cavity while the nose heals. This gel I apply inside the nose during surgery, and it semi-hardens into a soft, supportive material. And over the course of the week, while you're recovering, it gradually dissolves, which means there's no need for an additional removal process, which can be, unfortunately, a pretty traumatic experience for some patients. Now, the benefits of using a supportive gel are pretty significant. First, it's, like I said before, much more comfortable for patients. There's no pack that needs to be pulled out of the nose because it dissolves. As the gel dissolves, you can actually start breathing normally around it. And like we said before, there's no need for a painful removal procedure. This approach also helps to manage bleeding and oozing very effectively, and you should expect that after a rhinoplasty no matter what type of packing is put in. And just like it does with traditional packs, but it adds that comfort and convenience that we were just talking about. Now, of course, a cast on the outside of the nose is still part of my protocol. These casts or external splints come in all different shapes and sizes, but they are used to maintain the new shape of your nose, and they're typically removed a week after surgery at the same time as your follow-up visit to make sure everything is looking good. The external cast or splints can help everything hold itself in place while the internal gel does its job. Now, as I said before, every surgeon has their own preferred methods and protocols for post-rhinoplasty care. And the choice between a traditional packing or the newer methods like emulsifying gels often comes down to what works best for their patients and their specific surgical techniques. So, to sum it up, while traditional packing methods are very effective, using an emulsifying gel can provide a more comfortable recovery experience without the need for a painful removal process. And don't forget, that cast that I just talked about on the outside of your nose will come off after only a week, revealing your beautifully healed new nose. And that's all I have for y'all today, guys. If you found this video helpful, please give it a big thumbs up, subscribe to my channel, and definitely hit that notification bell so you don't miss out on more insights. Thanks as always for tuning in, and I'll definitely see you in the next video for more updates and tips.